Congratulations! You are now a part of the Coronary Health Improvement Project, or CHIP, a very successful lifestyle program designed to reduce your disease potential and increase your quality of life. While tens of thousands of people around the world have seen dramatic improvements in their symptoms of diabetes, heart disease, and weight management, and chances are excellent that you will too, we cannot guarantee your results. CHIP directors urge you to work closely with your current physician so appropriate treatment modalities can be adjusted or discontinued if necessary. Thank you.
Citizens of Western nations today are living the good life. Good jobs, good incomes, good times. They're living in the fast lane, fast travel, fast cars, fast foods. They're living in the land of plenty. Plenty of leisure time, plenty of food and drink, plenty of smoking, plenty of stress, plenty of disease. Heart disease, cancer, diabetes, stroke, high blood pressure, overweight. Is the good life killing us? Are drugs, needles, and surgeries the only solution? Dr. Hans Diehl and many other health analysts say no. What's his solution? Simple, effective changes in diet, attitude, and lifestyle habits. Great tasting changes, energy-boosting changes, money-saving changes, life-saving changes. Sounds too easy, too good to be true? Watch as Dr. Hans Diehl outlines his scientifically validated, medically sound plan for 30 days to better health.
I am pleased to be with you here. I welcome you. I applaud you for your good judgment in enrolling in the CHIP program. Health, we begin to understand more and more, is something that we do for ourselves in the context of hopefully an enlightened medical profession. We face a very interesting paradox in that we have worked hard for the last 2-3 generations to produce the good life. And now that we have the good life, the scientists tell us the good life is actually killing us. See, now we have a little bit of a cushion. The house has been paid for. The kids are in college, a nice college, a nice university. We have a couple of cars in the garage, and they're almost paid for. And all you do now is wait for the golden years. And suddenly, you're diagnosed with diabetes. Suddenly, you're diagnosed with angina pectoris, sitting on your chest like an elephant sometimes. Suddenly, you're struck by a heart attack, and you say, how could this be? Or cancer strikes. And yet, many of us are totally unaware that we are suffering from Western killer diseases that are largely self-made, they are lifestyle-related, and culturally promoted. All you have to do is turn the television on and see how many times they promote for you to eat more broccoli, or cauliflower, or eat more 7-grain cereal, or tofu. No! You know what you see there. We are a country, a society of dietary abundance with convenience foods, and the abundance that we have, the smoking, the extra alcohol, the extra caffeine, extra stress, all these factors conspire to create the soil in which this disease called atherosclerosis, that then leads to heart attacks and strokes and impotence and so on, can grow. It's very interesting that Americans no longer die. They just fade off the scene. By the time you're 40s of age, your weight goes up, your hearing goes down, your energy levels go down, your blood pressure goes up, your cholesterol goes up, and you think, well, what do you expect? I'm over 40, I'm over 50. You were not born to have these dysfunctionalities. And you would not have those, to a large extent, if we could bring our lifestyle a little bit more closer in harmony with natural law, with anatomy and physiology. But we have been brainwashed to live the good life. And folks, listen carefully. What you want is not the good life. That's the last thing you want. What you want is the best life. And the best life is a simplified life, a simpler life. A lifestyle where you pay more attention to relationships, to immaterial values, rather than to the accumulation of material values. Where you begin to have a simpler dietary lifestyle, where you get into a walking program, where you begin to leave some of the things out that are really artificial things. We were not born to be smokers. We were not born to be abusing alcohol. And so we wouldn't have this biological aging before the chronological aging if we would have closer understandings. What CHIP, or the Coronary Health Improvement, is trying to do is probably best illustrated by a story I read some time ago. A man was walking by some bricklayers. He stopped the first one and said, "Sir, what are you doing?" And he said, "Can't you tell? I'm laying bricks." He walked on to the next bricklayer and he said, "Sir, tell me, what are you doing?" "I'm building a wall. Can't you tell?" He moved on to the last one. He said, "Sir, what are you doing?" And he said, "I'm building a cathedral." CHIP is trying to help you to build a cathedral of power, a cathedral of knowledge, so that you can reside inside that castle, inside that cathedral. But if you want to do that successfully, you want to be here for every lecture, because you don't want to miss a brick in the wall. You don't want to miss a wall that may not allow you to build and construct the cathedral of learning and education, so that you feel empowered of making decisions that are appropriate for you. And this program then provides dietary choices where you make the decision of what is appropriate for you. I remember some time ago, we had just taken off at Los Angeles Airport. I was on my way to India to conduct a program for medical school there and to explore the reasons for the sudden emergence of heart disease in the Silicon Valley of India, in Bangalore. And as we got up to the 30,000-foot level, after about a few minutes, the lady next to me began to talk to me, and you exchanged some pleasantries, and then she popped the big question, and she said, "And sir, what do you do for a living?" And I looked at her, and I said, "I am a non-invasive brain surgeon." And immediately I had her attention. She looked at me. She was a very erudite lady. She looked at me kind of puzzled, and she said, "Now, did I hear that right? You said you are a non-invasive brain surgeon?" I said, "That's right, madam." She probably thought that I was living in Brentwood, had a couple of Jags in the garage, that knew all the prominent people there. And then I burst her bubble. I said, "No. What I do is I try to get into the minds of people. I try to get into the area that is above the earlobes, and I try to tweak things a little bit. I try to remove the curtains from people's eyes so that they can now implement a lifestyle that will give them a much better option of living a full life and a longer life, because I said, the way we live in America determines the way we die. Boy, I had her attention. He said, isn't that interesting? My husband had a bypass 5 months ago, and he has recurring angina pain. The elephant is sitting on his chest again. He can't get the stairs up without feeling the pain in his chest. We thought, since he didn't get the heart disease until about 62 years of age, we thought this new vessel that was taken from his leg, a vein, and stitched into the arterial tree of the coronary system, that would last at least 20, 30, 40 years. We had no idea that this could clog up again. I said, did he make any lifestyle changes? Like what? I'm not telling what I told her. But when we touched down in Frankfurt, we changed planes and we flew to India. It was the shortest transatlantic flight that I've ever had. We had an invigorating exchange of ideas. And when that woman left, she said, thank you so much. How I wished I could have met you a few years ago. Heart disease is largely a disease that is culturally promoted. It has to do with our lifestyle, how we eat, how we drink, how we exercise, how we smoke. As a matter of fact, most diseases are outside of the dictates of medicine. For instance, if you smoke, and people do this, you see a doctor every year, you have a physical, and when you leave the office, everything is fine. You walk home and you say, hey, I'm good for another year. Nothing there, everything is fine. But once that spot appears on the line, God help you. Because any help comes too late. I can tell you as a researcher that whether you have the finest surgeon in the world and you do everything possible medically and you spend $30,000, $40,000, $50,000, or you do absolutely nothing, within 3 years, the results are absolutely the same. You'll have an 85, 90% chance that you will have died from the effects of smoking. See, every cigarette takes 13 minutes of your life. Depending on how much you smoke, you give up 6, 8, 10 years of your life. Plus, you sacrifice the quality of life. Self-chosen or culturally promoted, addicted, and we don't know how to break out of it. You have a person coming to the emergency room mangled because of drinking and driving, a dangerous combination. And you expect us now to fix up everything. Difficult to do. You come with cancer, Western adult cancers. We're very limited in what we really can do. You come with heart disease, oh, we can do some wonderful things, but by and large, we are limited in what we can do because we have largely brought on the disease by following the dictates of a culture or society that is into marketing, profits, and couldn't care less about health. All you have to do is next time go to some of the supermarkets and check out some of the items. It says, shelf life until January 1, 2010. We're more concerned about how long this food will stay on the shelf than we are concerned about the people who eat this food. And so I want you to know that I am looking forward to 30 interesting days with you. This program will not work for you unless you invest yourself in it. This program will not give you maximum results unless you begin to open your mind and listen very carefully. I will give you the best research that we have today. I will not give you a study on 5 grasshoppers to extrapolate the sex life that we should have. No. I will talk to you about $150 million studies. I talk to you about large studies that have involved the finest scientific brains in the world so that you can take a look at strong scientific evidence and then you can begin to make choices as you see fit. Is that all right? Whatever results you will have, after all, you had your heart screen, your coronary screening just a few days ago. You will get these results back in just a few days. And some of you will face that moment of naked truth with some trepidation. But look in the mirror when the results come. We'll explain everything very carefully to you. We'll give you a booklet so that you can study it for yourself. But then remember that within 4 weeks, within 30 days, you have an excellent chance that your cholesterol levels will be down by 15 to 20%, which translates into reduction of heart disease risk by 50 to 60%, and that's just the cholesterol levels. You can expect that if you're obese, that you will drop your weight by about 5 to 10 pounds, and you have eaten more than you have eaten in your life, I promise you. That's what everybody says. We eat like horses and we're losing weight, that's it. Any takers? I mean, you want to eat more and weigh less? No gimmicks. There's nothing to sell in this program. We just provide you with the best education that we know that we can bring to you. We'll help you to bring your blood sugar levels down. And if you have diabetes, if you have blood sugar levels above the norm, be sure that you make even now an appointment with your physician for the end of next week. Because if you're on insulin, your physician has to adjust the insulin levels because you will need less and less insulin as you get into the right program, especially if you join the fast track approach, the jump start that we talked about. If you're on high blood pressure medication, see a physician within a couple of weeks and begin to chart down your blood pressures every morning, and we'll help you with that next week so that you can show your physician what is happening. And chances are that you don't need as much medication, especially if you have essential hypertension, which is the most common form. Let me read to you something that my colleague wrote. It's very well expressed. It says, "The village well was poisoned and people fell sick. The doctors, the nurses, the villagers all ran about buying new beds, giving medicine, providing lifelong care for those permanently crippled or diseased. They became very adept at treating the ill. They refined the medicines. They discovered new and stronger antidotes. They trained people to care for the sick. They built beautiful buildings to accommodate the chronically ill. Better treatment procedures were invented with marvelous mechanical devices. Emergency services were developed to a remarkable degree of efficiency. There had never been better medical care anywhere. But the patients kept coming and coming and coming, and the statistics kept rising and rising and rising because no one treated the source of the problem, the poisoned well." And Dr. Allen says, "Today our culture is a poisoned well. Our culture does not encourage people to be healthy. Even our medical care system is not a health-promoting one. It's a disease care system that focuses on our illness after the damage has been done. It has become a salvage operation that has largely specialized in the management of the victims." What Robert Allen is saying here is, he said, we're basically practicing patch-up medicine. And he continues. He said, we spend billions of dollars for surgery, for coronary care units, for kidney dialysis machines, for radiation therapy, and chemical treatment of cancer. Our efforts and our money to treat the disease, the results of our illness is phenomenal. Researchers, he says, produce new chemicals and radiation techniques. They try to treat the tumor-filled lungs of smokers on their way to death. Billions are spent for immaculate, intricate, expensive, electronically monitored, technically refined coronary care units for the heart attack victims whose bad eating or smoking habits brought them to the crisis. We have looked at disease so long that we have become blinded and forgotten about health. CHIP is an adventure in a healthy lifestyle. Health, after all, is largely a function of how people take responsibility for their own actions. Promoting health, therefore, has to do with education and cultural transformation. We want this to become a healthier city. Don't you want to help me? What we're doing, we're trying to change the culture. That's why I'm pleased that many of you have brought your spouses. That's one of the best things you can do. If you don't have your spouse here, please do not go home and become an evangelist. You will just scare your spouse away. But try to be very wise of how you release certain information. The most important thing for you to do is live the lifestyle that we begin to offer to you. And as you become a new person from within, and it begins to show, the weight comes down, you'll have more energy, your blood pressure, medication needs probably come down, your diabetes improves. As those functionalities improve, only then do you really have earned the right to talk to your spouse and to your friends. Because they may not listen to what you tell them. Because after all, they say, since when has she become an expert overnight? It's human, isn't it? So be very, very wise. Work very carefully. We want to change the culture. We try to make it easy for you so that cultural transformation can take place. So we're delighted to have you here. We're delighted to give you some ideas of how you can follow this program by doing your reading assignments every night or during the daytime. And if you should get behind just a little bit, remember there's always a weekend where you can catch up. But everything has been very carefully planned for you so that you can follow the program optimally and making choices that are based on intelligence and evidence.
It's time for Sound Bites, news and views you can chew on.
For me, the bottom line is be informed, ask questions, check out the science, ask more questions, and if you're not satisfied, oh boy.
That's nice, isn't it?
That is so nice, yeah. I have to say, one of the overriding characteristics of this program, as I observe it, is just the really positive atmosphere. The program is fun, and you can just tell by when looking around the room and feeling the positive energy.
I've lost about 12 pounds in a 2.5-week period. I eat heavy grain breakfast, and I farm, and I go out in the field, and I plant crops, and I stay there all day. I don't need to come in for lunch.
I tell you, I feel like Rocky III, and that I ought to be running up those steps in Philadelphia. I just felt myself day by day becoming stronger. When I was walking, I couldn't keep myself from breaking into a jog. And I've worked much in the yard. I don't have an ache or a pain. I feel almost invincible.
Yeah, you had some big changes in your cholesterol, right? You dropped about 35% or something like that?
I dropped 50 points.
50 points.
My goal was to have a cholesterol level of 150 because that seemed to be the magic number.
Yes.
And that was my goal, and fortunately I exceeded that. I went down to 130, I think it was. So that was a real reward.
When we look at American society today, when we look at mortality and morbidity patterns, we recognize that heart and stroke as the cause of death are clearly number one, being responsible for every second death, followed by cancers taking every fourth life. Now, that means that 70%, 7 out of 10 deaths are due to these two major killer diseases that cannot be found in most societies around the world. These are Western killer diseases because they occur only in Western society or societies where they eat and live like Westerners. Please take a look at breast cancer. The rates have gone up rather constantly, so that today we expect that 1 out of 7 women will come down with breast cancer. And you can see that the proportion has increased on a regular basis. Prostate cancer similarly, and although some people may suggest that this is because we have better ways of diagnosing the disease, there's a net increase in these Western killer diseases. And what we usually do is we assume that modern medicine can take care of all these problems, and thus we minimize the importance of taking care of ourselves. I have some good news and some bad news for you today. The good news is that you can reverse many of the cardiovascular diseases that we have in our society. You can reverse, disarm most of diabetes. You can reverse, disarm hypertension. You can bring down cholesterol levels 10, 20, 30%. You can do it with a fork and knife and with a new lifestyle. That's the good news. You can actually eat yourself out of angina pain in 2 to 3 weeks. We'll show that to you very carefully the next few weeks. That's the good news. The bad news is that you have to do it. And in American society, in Western society, we assume that if something goes wrong, it must be fixed by the doctors. And so we look at bypass surgery, we look at angioplasty, we look at many, many sophisticated techniques that are largely performed after the fact in trying to save lives during acute situations. Please note, 450,000 bypasses this year again, average cost $50,000 if everything goes well. And yet, we know that many of the patients who have relief from angina as a result of bypass surgery, for instance, will have recurring pain again after a period of time. You look at angioplasty, where the plaque inside your artery is being compressed so that blood can flow through. 45% of the angioplasties are no longer functional within 6 months, and we have to go in again. It is only a staying of the execution, unless you do something about the causes of the disease, and then there's every indication that you can increase the lifespan of these procedures. Please note, mortality for bypass surgery. The likelihood that you die from the bypass surgery in terms of complications from a heart attack or stroke is about 2 to 10%. The risk of a heart attack during surgery is 5 to 10%, and that applies to strokes as well. But please note that when it comes to survival, when you have bypass surgery, we have only clearly documented evidence that bypass surgery will lengthen the life of a person in 10% of the cases. Here you see it. Only 10% of heart attack patients actually have their life extended after bypass surgery. Imagine what we do. We don't recognize, oftentimes, that these vessels clog up again, just like in the story I told you. As a matter of fact, some statistics suggest that 10, 15, up to 25, 30% of all grafted vessels that you've taken, harvested from your leg, and stitched in, veins that are much weaker than the original artery, are clogged up again within 12 months after the surgery. And you say, well, I don't really worry too much about that because my vascular surgeon would be glad to give me a second bypass for another $50,000. We're doing today do's, redos on redos. But we cannot continue in this fashion. And the evidence is very good that 80% of bypass surgeries could be avoided through dietary change according to the U.S. Senate. Here's the post-coronary artery bypass graft trial, which shows that those people who brought their cholesterol down after the implant, after the bypass surgery, had 29% fewer need for revascularization techniques. The point I want to make is that if you have to have a bypass, then it is incumbent on you to learn all you can and begin to identify the different faucets that are overflowing the sink so that the water's on the floor. And don't expect your physicians to mop up all the time. But we need to begin to identify these faucets, these causes, and turn them off and bring our lifestyle more in harmony with natural law. That means we have an opportunity to help ourselves. It is truly remarkable what we can do in medicine today. We talk about modern miracles. We can take a person whose leg was severed in an accident, and under the right circumstances, we might be able to do microscopic surgery and reattach that leg, and the person is walking again. We can take detached retinas and weld them back into place with laser technology. We can take livers and exchange them. We can have liver transplants and pancreatic tissue transplants. We can have heart transplants. Remember when Barney Clark had this heart transplant and he toasted the world with a Schlitz in his hand? We can take a baboon heart and implant it, as was done at Loma Linda University, where I come from, and implant it into baby Faye, and baby Faye lives 22 days. We can do these wonderful things. We can do different implants and transplants, and some people are hoping for brain transplants pretty soon. We can do wonderful things. This is an exciting era to be alive. We have CAT scanners, test tube babies, split genes, pharmaceutical inventions to remedy everything from migraine headaches to depression, from hypertension to epilepsy. We have the most advanced technological system in the world. We have elaborately equipped medical schools, regional cancer centers that are the envy of capitals around the world. We have an abundance of super specialists in our hospitals, and our genius for biomedicine and biotechnology promises even greater miracles just around the corner, hopefully creating the bionic man and the bionic woman with interchangeable parts. We see it every night on television, and we have the idea that this heroic form of medicine is affecting all of us, and we no longer have to worry about anything as long as we pay our insurance premiums and just be close to a center where something can take place. Well, I'm afraid that I have to burst that bubble just a little bit. While we sometimes create or have the impression that modern medicine, with all the technological wonders, is omnipotent, we're basically limited, if not impotent, when it comes to Western killer diseases. We can talk about lung cancer, we can talk about certain other adult cancers, we can talk about heart disease, we can talk about kidney disease, we can talk about diabetes. The answers are fairly elusive. And if we can sometimes make a contribution, it's usually not lasting all that long. And I think what we need to recognize is that while there are miracles, just imagine what we could do if we could bring our lifestyle more in conformity with natural law. The answer then is not to manage a disease and to take care of symptoms. The answer has to be found in turning off the cause of the epidemic. When you have heart disease and you have that angina pain, the answer is not just to take a nitro so that you feel better. That helps in the quality of life. So that now you die progressively without feeling anything, but you die prematurely, not realizing that pain is really a friend, a warning system that is helping you to structure your lifestyle with the limitations that you have developed now, or to help you to understand that you need to make changes in how you live. And so it's very, very tempting to move to the cabinet where you have all these special drugs, most of them probably expired. Go home and check it out, you'll be amazed. But where you take all these medications and you think that's going to be the answer, it's only a very limited answer. Let me give you an example here as we talk about medication. We are a society of pill poppers. I'll give you some illustration as we begin tonight. What people don't understand is that probably 146,000 people die every year as a result of the side effects of prescription drugs. Either the medication wasn't taken properly, or it wasn't properly prescribed, or there were interactions between different medications. Which means that 7.5% of all of our deaths are due to prescription drugs. And here's a little exaggeration probably. You see a physician, he has just made his rounds at the hospital and tells his patient, look, you'll be very glad to know, I have good news for you. You'll be glad to know that of the 17 drugs we gave you and the 43 side effects that they caused, we found 6 of the drugs to be effective, and we have cleared up 28 of the side effects. There is not one drug without a side effect. We could give you a litany of examples. We should first use lifestyle change to see if we really need the medication, or if we need the medication, we have to see if we can gradually modulate the need for these medications. By the way, I want to make very sure that none of you is changing his or her medication in the next 30 days without working with your physician. Okay? Your physician knows your situation better than we do, and so we want to encourage you to work very closely with your physician. If you look at medical journals, I just picked this out last month, and you see these ads. The doctor told me I would probably be taking blood pressure medications for the rest of my life. Wrong. Not if you're willing to make some lifestyle changes. You have an excellent opportunity. You have an 80% chance to being off these medications if you're willing to attack the cause and do something about your lifestyle. This is no longer true. This is an advertisement by a drug company, as you would guess. Heart disease. It's not something that we always have had. It's not a disease that's universally found. Please note that it was virtually unknown until the 1920s. You look at a medical book from the 1928, Sir William Osler's book on medical care, medical internal medicine, and it will say that you can expect 1 heart attack per year in an average hospital in an average size of a town. 1 a year. Let me tell you, you call medical students in their second year and you say, you want to see a heart attack? They just turn their backs and say, we have seen too many already and we don't want to see anymore. It is an epidemic today. We hardly knew what it was until the 1930s. And please note, this is the advent of cardiovascular disease. This is coronary artery disease coming in here. This is rheumatic heart disease. It is a disease of the 1930s, eclipsing 1970, reaching its zenith, and since then coming down by about 2% a year. It's a disease that is only found in 10% of the world's population, and that's where it is epidemic. That's the way it was in the 1960s. In the 1980s, we found it in 20% of the world's population, and now the epidemic is found in 35% of the world's population. Please note, coronary artery disease is spreading rapidly. It assumes global proportions, and it follows westernization. It follows a Western diet. It follows Western convenience foods and the general lifestyle. Now take a look at the amount we spend on medical care. We used to spend $200 a year per person. Now it's $6,500 a year. And that's per person. We have 2 children. So my wife and I would have to set aside $20,000 a year for medical care. And you say, well, we don't have to do this. Well, but somebody's paying your bill because we're paying this year $1.8 trillion. That amounts to $6,500 per person per year. Amazing. And people say, well, but there's probably a lot of inflation there. Because after all, we now understand that building a hospital with 100 beds, for instance, costs about $400,000 per bed. And the equipment you bring in is obsolete within 10 years. But please note, when you see it in the context of the overall earnings of a society, which now neutralizes the effect of inflation, we used to spend 3, 4, 5% on medical care until the 1960s, and then it began to really rise very steeply, and today it's 16%. When you go and buy a car from General Motors, please remember that the number one cost factor of that car in Detroit is the medical care of the employees who build the car and not the steel that goes into the car. And American companies, to try to be competitive, they try to find ways to improve the level of health of people. That's why I'm working with corporations now. In the United States, we spend $6,500 per capita. In Britain, they spend only $1,800, and the British people, they live longer than we do, and their infant mortality is lower. In Japan, they spend $2,400, and they live 4 years longer, and their infant mortality once more is much lower. The point here is, you cannot buy health if you don't take care of the basics. If you could buy health, then Americans should have the best health, should live the longest. Well, sometimes people come to me, especially when I talk at medical conventions, and they say, well, you're trying to make a very strong point, but you sound like an alarmist. I mean, you have it all wrong. After all, you know, people live so much longer in America today. That's why we have so much heart disease, because it happens when you're 50, 60, 70. That's why we have so much cancer. That's why we have so much diabetes. These are the diseases of aging. How wrong can you be? These are not diseases of aging. They're diseases of lifestyle. We can show you, and we'll do it tomorrow night, the difference between a man in America at age 35 and a 65-year-old Japanese. And the 65-year-old Japanese, I show you the data tomorrow, will have less narrowing of the arteries at 65 than an American living in this country at the age of 35. No disease of aging. Misnomer. Diseases of lifestyle. Well, but let's look at the argument. Let's say that we have so much heart disease and these degenerative, so-called degenerative diseases because we're living longer. Do we live longer today than people 100 years ago? Do we? How many years? Anybody? If you can read the slide, you give me the answer, and it's correct. No trick. A baby born in 1900 could expect to live 49 years. A baby born today can expect to live 75, 76 years. So we have gained 27 years, right? Right. So the argument is a very good one. And then I visited England. I spent some time there, spent some time with Dr. Dennis Burkett, a very close friend and colleague of mine while he was still alive. And I looked at some of the cemeteries, immaculately kept. This is what I found. Susanna Batten died 1902 at the age of 84. And I thought to myself, how could this be? I thought they all died at 49. I thought maybe this is one of these George Byrne types. You know, they do anything wrong and somehow they live a long life. But remember, there are only a few George Byrnes that survive and can tell the story. Did you get the idea? So I looked around and I thought maybe this is just a singular case. And I looked at Mary, departed this life 1920 at the age of 81. I said, wow. Then Joseph Ward Redding, who departed this life 1931 at the age of 95. And I looked around, 85, 95, 75, 69, 89 years. And folks, in those days, they had no medical care. Physicians were just glorified barbers at the turn of the century. How could it have been? I thought they all died at 49. And then I began to look around at the cemetery, and I came to an area with small tombstones, babies. Here lies our beloved Mary. Here lies our handsome Freddie, age 7 weeks, aged 7 months. And then I began to realize that every 5th baby died before the age of 1 at the turn of a century. What does it do to the life expectancy at birth? It dramatically reduces it, and I began to look into this a little bit more. This is what you find in America. The infant mortality dramatically decreased over the last 100 years. For newborns, for children 1 to 14, dramatic improvements because of medical advances and particular public health advances. The death rate for young lives, 15 to 24, also declined fairly significantly. And now you have to ask the question differently. Listen, what about a 30-year-old person that doesn't have to worry about these childhood diseases like infectious disease anymore? How about a 65-year-old man or woman? So we took a look at this here in America. We found that in 1900, a 65-year-old man could expect to live about 12 more years to about 77 years. While today, if you're 65, you can expect to live an extra 18 to 19 years to an average age of 84, which means we have added how many years to our lives over the last 100 years? Give me the answer, please. Yeah, very good. No computer, no calculator, sure, great stuff. Please note, life expectancy for men at age 65 went up between 4 to 7 years. It's gradually going up, but it's still not much more than 6 or 7 years for a 65-year-old man. And I propose to suggest that some of the people that live long lives, many of them oftentimes do not spend their lives in independent, autonomous living arrangements, but rather cared for long-term facilities. So we're talking about the quality of life now. You see, we're not just concerned about extending the quantity of life, but we're concerned about extending the quality of life and to extending the good 40, 50-year quality of life to stay with us for another 20, 30 years, 40 years. The Kellogg report says, why amid so much scientific progress do these lifestyle-related diseases continue to eat through our population? How, in the face of an unprecedented national research effort, have these lifestyle diseases advanced to the point that they cause 75% of all American deaths? Good question, isn't it? The report that has a second question. Why is the magnificent achievement that is American medicine so confused and weak before the leading killers of our people? With rapid technological advances and progress on other fronts, we seem to be felling more and more trees in medicine today while quietly being overtaken by the forest. Here's some of the answers. Professor Eisenberg said, medical intervention after the onset of chronic illness has little influence on longevity. He said, this is powerful, attested by the negligible change in the American adult life expectancy, despite the heroic technical virtuosity of modern medical measures. It comes too late. Medical care comes after the fact and tries to remedy what can be remedied with great skill, with heroics, and with a lot of investment in time, effort, and money. While we support this concept, would it not be better to complement that with a strong preventive medicine approach? Today, we spend only 2% of our multi-trillion-dollar medical care budget on health education and preventive medicine, teaching people, helping people, so they don't have to fall into the poisoned well. It's a society that is operating on the basis of profit and not with regard to health issues. When I spent some time not too long ago in Germany to talk about smoking there, I'm a member of the German medical group that is promoting a smoke-free society. The government made it very clear that they could not promote an abandonment of cigarette smoking in Western society in Germany because they said half of the defense budget is funded by taxes from tobacco. So there you go. The Journal of the American Medical Association provides some very interesting insight here. The question is asked, health care, does it equal medical care? And the answer is, many people mistakenly believe that health care is synonymous with medical care. Health is largely a matter of personal responsibility. Medical care has relatively little impact on health. Dr. Frederickson, director of the National Institutes of Health then said medical care's contribution to health is marginal. Health is affected not so much by medical care or by heredity or by environment. They play a role in determining health, but the largest contribution comes from our lifestyle. It's estimated that 60 to 70% of what happens to us is related to choices that we make on a daily basis, how we eat, drink, smoke, live, and love. And we begin to realize abundance, as Churchill said, can be a curse to people. Too much of a good thing. Here's Dr. Dennis Burkett. He received the highest price that American scientific and medical institutions provide for leaders in the field of science and medicine. He had just received a $350,000 prize from C. Everett Koop, then the Surgeon General of the United States. They were some of the finest researchers and experts in medicine meeting in Philadelphia in a 3-day conference to honor this great man. A man that spent many months during the last 5 years of his life in working with me in establishing the chip concept. Dr. Burkett was extremely apt in communicating his concerns. He said to these physicians, ladies and gentlemen, we need to change our practice of medicine because we're basically mopping up floods on the floor that are being caused by environmental aspects of our lives. And he said, you have beautiful art objects. They're very unique. You cannot find them anywhere else. You cannot replace them. They're on a shelf, placed somewhere. But because the shelf is crooked and leans forward, oftentimes in due time, these art objects slide off the shelf and they break into many pieces, only to be picked up by a very dexterous, trained person that with the advances in wonder glue and miracle glues can now take these pieces and put them together again, admired by those that stand by and say, wow, what an amazing breakthrough. Wow, this has to be published. This is worth publishing. And the chairman of the board of the Wonder Glue, Miracle Glue Company stands by with great delight because he knows it's going to be a good meeting with the shareholders. Burkett said, this is what we do in medicine. We got to change it. And this is a slide that he showed to these dignitaries. He said, ladies and gentlemen, if we would only begin to tweak the shelf a little bit, maybe we wouldn't have to work quite so hard in picking up the pieces from the floor, only to put them back on the crooked shelf so they slide down again. But he said, when we do this, when we break with traditions, those who do become suspect immediately because others will stand and say, who is this man? Where did he come from? Where did he go to medical school? Does he carry union papers? Is he part of the priesthood? Because after all, we don't do things this way. And everybody is upset. We cannot publish this, that you just do a little tweaking. Nobody would accept that. And look at the chairman of the board. He's totally disgusted because he knows it's going to be affecting his profit line at the end. And Burkett said this. He said, only by straightening the shelf and by turning off the faucets will we ever conquer our current diseases. We will never do it by improving the glue or the method of mopping. We need to make some changes. We have to get out of our balanced lifestyle. That is, one hand on the gizmo to choose the channels, the other hand on a beer. We are beginning to understand that this lifestyle has inherent in it many, many risks affecting our lives, the quality and the quantity. And so we begin now to see that lifestyle medicine is coming more and more into vogue. We see physicians struggling in how to teach people, especially when they only have 5 minutes to see a patient one-on-one. The waiting rooms are full, and if you really spend an hour time, are they really going to appreciate it? And will medical insurance companies and policies pay for the extra hour that we're investing? Well, here's one of my colleagues. He's in lifestyle medicine. He wants to save the world by educating people. And you see the results, he lost all of his hair. That's what happens. You pull your hair out. He's spending a whole hour after physical with his executive, and he says, look, the best way to achieve good health is to take care of yourself. What you need to do is recognize that your lifestyle is destroying you. You should change your eating habits and stop smoking and drinking. You should get into an exercise program, get plenty of rest, and learn how to handle stress. And finally, my colleague has found one grateful, appreciative soul. And he figures it's worth it all. He feels this man has made his day, and he probably goes home that night telling his wife about it, that somebody thanked him for spending an hour in helping this person to understand how to change his lifestyle, develop more autonomy, and turn this disease around. And isn't that the way it usually is? We want that magic slip. Listen, I have a golf game in 3 months in Dublin. I don't have time for making all these lifestyle changes. I need to have some quick fix, get me a bypass, and get me out of here. It's paid for, isn't it? I spoke before the Federal Council on Aging, and I said further expansion of the nation's medical care system is likely to produce only marginal increases, if any, in the overall health status of Americans. What we need is not more medicalization. What we need is better health. We don't need more surgery. We don't need more medicines. What we need is better health, and better health is under your and my jurisdiction. That's what CHIP is all about, trying to help you to understand so that you can make wiser choices. Joseph Califano said, we must replace our prevailing ethic of expensive self-indulgence with an ethic of rigorous personal responsibility. The choice is simple: take increased responsibility wisely, intelligently, or continue the wasteful sick care system with its staggering toll in dollars, wasted lives, and grief. You are the salt of this town because you can season the community at large, but do it gently. Don't be an evangelist. Don't be a missionary. Listen carefully. Reversing disease with fork and knife. We begin to realize today, more than ever before, the power of the plate of what you eat today is going to walk around tomorrow. You can change the thickness of your blood within 2 weeks, and you need to reduce your Coumadin and your blood pressure medications and your nitroglycerin count. And your physician will have to work with you because you're putting something good into your systems. Food as grown, not engineered foods that come in crinkly bags. We try to help you to understand that within our chests, within our arteries, is an insidious killer on the loose that you feed 3 times a day, and it's taking over more and more of the intraluminal space, as we will discuss tomorrow. Our purpose here is to diffuse that time bomb and to help you to get your cholesterol levels down, to bring your blood pressure levels down, to help you stop smoking, to move your buns, to eat more and weigh less, to lose weight, to disarm diabetes, and to manage your stress. And we can do it. I would like to interest you. I'd like to motivate you. I'd like to inspire you to take better care of yourself so that together, as enlightened medical care providers and inspired, understanding, knowledgeable participants, together we can beat the disease that kills every second person. Do you want to help me? Yes. Thank you.
Welcome to the CHIP Hall of Fame. Comments from CHIP participants who have experienced the thrill of victory through adopting and living the CHIP lifestyle.
I worked in an intensive care unit, a coronary care unit, for 10 years. And I saw lots of people coming in with many types of diseases, such as heart attacks, strokes, diabetes. They all came in, and we gave them medication and helped them to cope with their illness at home. But they kept coming back. And I was always thinking, isn't there any way that we could prevent this from happening? A few years later, I got involved with the CHIP program, and I met Dr. Diehl. And all of a sudden, the light turned on. I thought, hey, this is great. There is a way to prevent people from having many, many types of diseases. With the CHIP program, we saw people that have had heart attacks get better and go home and be well and not be readmitted to the coronary care unit. We saw people with diabetes drop their medication, and some of them went right off their medication. We had people with high blood pressure in the CHIP program that after they'd made some lifestyle changes, stopped taking their high blood pressure medication. I really felt terrific when Dr. Diehl was able to work with these people and send these people home with a health message that they could look after their own health. They could manage their own health at home. And because of that, I became involved with the CHIP program and started to work with the CHIP program and help people learn that they can take charge of their own health. From a nurse's point of view, from a professional point of view, the idea of prevention really excited me. So I started doing that in my own employment at work, in my own neighborhood, in my church, in my community. I'm teaching prevention, and I've learned it from the CHIP program and Dr. Diehl. It's just marvelous now that the physicians are working with us and are able to decrease some of the medication that people are taking. They're able to assist us and are grasping these concepts and helping their patients learn that they can take charge of their own health.
The CHIP Hall of Fame. Will you be the next member?